People often will say anecdotally, when you're stressed out, you get sick. It's known that stress will increase inflammation markers, but also you mentioned ultra processed foods also increase these inflammation markers that might then result in some sort of disease. So what can you say about inflammation in general as to how it can affect both your mental and physical health? Is there a connection?
Yeah, so there's a large body of literature looking at inflammation across all mental disorders, more so in the mood disorders for like depression or bipolar disorder. And it seems that, these associations exist with food, diet, exercise, etc. And even in predicting people that develop depression or develop a bipolar disorder, or during the active phases of their disorder have higher inflammatory levels. So both systemic or central inflammation. So it's not definitive enough to say that inflammation is driving all of depression or all of bipolar disorder. But it does seem that there are maybe subgroups that would benefit, where they're even in JAMA Psychiatry recently, I think they'd released an editorial speaking about an inflammatory subtype of depression. And maybe someone may benefit more from these anti-inflammatory treatments, which I am a big proponent for, adding more detail to the diagnosis of depression. Because right now it's this term that just catches everything. And there's so many different ways to diagnose it. We treat it all the same way, but I think it needs to have more detail to treat specific symptom clusters or stuff like that. So yeah, I think inflammation does have a role in depression, bipolar disorder, even other disorders that we didn't directly speak about, like schizophrenia, anxiety disorders, PTSD. And it may even mediate some of the connections to the physical health outcomes that we see, which makes a lot of sense too.